Autism Spectrum Disorder is a brain development disorder in which there are delays in a person's brain development beginning in childhood, which causes difficulties with their social interaction, their communication, and repetitive behaviors. Understanding autism red flags can help you identify potential problems early in a child's life, giving them a better chance at healthy development. When action is taken early, children are better able to overcome common difficulties and integrate into society more successfully. These are 7 signs that professionals look for when screening children for autism. 1. Joint attention. A child with autism will seem to avoid eye contact. They may look away or be more preoccupied with what you're doing rather than looking directly at you. When you say to a child, "Look," as you point to something, a typically developing child should be able to follow your point to look at what you're pointing to. Joint attention is so important because it's how a child interacts with their caregiver, be it a parent or a teacher, to learn what words mean. Children with autism have problems following joint attention, and this in fact is one of the core diagnostic features of autism. When a child is not constantly doing this by 12 months, it's considered a red flag as it inhibits discovery, which will have an effect on their communication going forward. 2. Difficulty attending to or answering to their names. By 12 months, typically developing children will turn to look at you when you call their names. When a child appears uninterested or unaware of what's going on around them, again, this is flagged up. 3. Use of gestures. Children with autism have difficulty using or imitating gestures. What this means is that they do not point to objects to get your attention, and they may also have difficulty requesting for what they want, and may instead pull you towards it. Gestures are a precursor to verbal language. So if by 15 months, a child isn't consistently using gestures to show you a toy or to wave, but instead show restricted, rigid, and even obsessiveness in their behaviors, activities, and interests, then again, this is flagged up. This may include repetitive body movements, such as hand flapping, rocking, spinning around, moving about constantly, or an obsessive attachment to unusual objects, a preoccupation with narrow topic of interest, sometimes involving numbers, symbols, or statistics. It may also include a strong need for sameness, for order and routine, for example, toys being lined up or following a rigid schedule. It could include clumsiness, a typical posture, or an odd way of moving. They may be fascinated by spinning objects, moving pieces or parts of a toy, or a hyper or hypo-reactiveness to sensory input, such as reacting badly to certain sounds or textures, seeming indifferent to temperature or even to pain. We will talk about 4 more autism red flags in part 2 of this video.